So now that we've gone through what makes up a bone and how it is structurally, we can start talking about the skeleton itself, which is divided into two regions. The axial skeleton, which includes everything around the vertical or longitudinal center plane of the body, the skull, the spine, 80 bones. And then we have the appendicular skeleton, which includes the appendages, the arms, the legs, and that's about 126 bones. So the skull, most of the bones in the skull are flat and they're designed to be protective. So each bone is joined by a structure, a joint made of dense fibrous tissue. So your skull is actually a group of bones that fuse together, but they have a little bit of a joint in them. So if you look, the fontanelles are the soft spots we talked about with an infant. So the fetal skull has a few structures that are much wider, called fontanelles. These allow the brain to grow and expand, convert to bone with about 2 years. So this allows the baby, because they're going to rapidly grow, their brain development, passing through the birth canal. All of these things are why babies have fontanelles. And so they are the soft spots on their head. So here's a picture of the skull. It's a lateral view, and we can see the frontal, parietal, siphonoid, occipital, temporal, nasal, zygomatic, maxilla, and mandible. Now, interesting enough, occipital, parietal, frontal, these are all going to be parts of the brain as well. So it would help you to memorize them now. So you see, you hear about these things, the zygomatic arches, nasal bones. If you watch a lot of mixed martial arts, you'll see people will have a tendency to break some of these facial bones. Mandible, the jaw gets broken. Much less likely that you're going to break, the parietal bone or the sphenoid bone or the occipital, temporal. These bones are much thicker and stronger, especially the occipital bone. If you touch the back of your head, it's much thicker there. And obviously that's to protect the brain. All right, so that's their primary function. Now, if we look from the inferior view, the bottom, there's the maxilla, there's the sphenoid, there's the zygomatic. All right, we can see, do you see the zygomatic arches, why they're referred to as that? They're a little arch. There's a little bit of evolutionary history to that, which we could talk about in the future. But, it has to do with our evolution from reptiles, actually, with some of these openings in the skull where muscles pass through. We can see these openings in different organisms. Parietal, occipital, and then there's the mastoid process. All right? And then we see the sinuses. Sinuses are hollow bones with thin plates between them. They're designed to drain fluids. Sinus headaches happen when they get blocked and the fluids overflow into the nasal cavity. So what happens is, if you have some kind of blockage, what'll happen is the fluid builds up in those sinuses and it allows bacteria to thrive and grow. And that's when you get a sinus infection. Okay, so what they can actually do, I know from personal experience, is they go in there and they can grind the openings wider. Now, there's actually small bones in your sinuses that look like little honeycombs. And what they do is when they go in there, not only do they grind out the openings, so there's a wider path for the fluid to drain, they'll also clear out some of the bone that's in there. What happens in, less than 1% of the time is sometimes when they're clearing that bone, it can crack your skull. And then you're leaking cerebral spinal fluid, and then they have to go in there and close that off. Not a fun thing to do. You got to worry about meningitis and different infections, but you get yourself a good surgeon, they'll fix you up when that happens. So we see the hyoid bone is the only bone in the entire body that does not form a joint with another bone. The base of the tongue attaches this bone and aids in swallowing and speech. Now we have the ossicles, which are going to be the bones of the ear. It's the hammer, anvil, and stirrup. They do have scientific names that you could use, but hammer, anvil, and stirrup are widely used and acceptable options to use talking about the ossicles. Vertebral column, 24 vertebral bones, each separated by a disc of fibrocartilage. The vertebrae are named for their location, so C1 through C7 are in the neck. Okay, the cervical vertebrae make up the neck. Then the thoracic vertebrae from your upper back. So you can kind of feel where it switches from cervical to thoracic. If you run your hand down the back of your neck, that bone that sticks out is where it's going to start to become thoracic vertebrae. And those are T1 through 12. And then your lower back, your lumbar, think about it, lumbar support. Those are going to be your L1 through 5 on your lower back. And that's usually people, one of the downfalls of being a bipedal organism. Through our bipedal evolution, we tend to have bad backs. All right, that is one of the trade-offs of being bipedal is lower back pain. All right, so, and then 2 bones are found below the lumbar region, and they're from 9 vertebrae fused together. They're your sacrum and your coccyx, all right, your tailbones. Now you look at the vertebral column right here. There's the atlas and the axis, the top bones of your cervical, C1 through 7, thoracic T1 through 12, lumbar L1 through 5, sacrum, and coccyx. You could see that there's a difference in the way the vertebrae look as you move down. You see the thickness of the lumbar increases and all that. And you can see from this diagram right here, here's a cervical vertebrae. It's got vertebral body, vertebral foramen, and then the spinous process. All right. Now you see on this right here, that spinous process looks quite different on a thoracic vertebrae. And then look how vastly different the lumbar looks. It looks like some kind of sea creature right there, and it sticks out much more. Next, you have your ribs and your sternum. Ribs protect the major organs of the thoracic cavity, heart, lungs, things like that. Ribs articulate with both the sternum and thoracic vertebrae. Now, the true ribs are connected directly through the sternum, ribs 1 through 7. Ribs 8 through 12 are called false ribs because they are connected through cartilage. So they're not really connected to the sternum. They're connected to cartilage, which connects to the sternum. Or 11 and 12 are false ribs. They're not connected to anything. They float around. So you can see in this next picture right here, you see your body of the sternum. And then when you look, do you see how the bottom group of ribs are connected to cartilage and then to the sternum? And then if you look at the very bottom of the diagram, you see that you can only really see one pair floating there, but there's another pair above it that floats. You can see them sticking out at the bottom. They're connected to nothing. Okay? And so there are your true ribs 1 through 7, false ribs 8 through 10. So you can count them out and see which ribs are 8 through 10. Obviously, those bottoms being the floating ribs are 11 and 12. So the appendicular skeleton, we have parietal, occipital, all right? We see the clavicle right here. The clavicle is the collarbone. Scapula is your shoulder blade. So you can feel your collarbone right below your neck. You have one on either side. That's why you ever notice somebody who breaks their collarbone, they put them in a sling. And the reason for that is because that collarbone will actually articulate with the scapula, the shoulder blade. So if you put your hand on your collarbone and then move your arm up and down, you see your collarbone is moving as well. So if you have a broken collarbone, moving your arm is going to be quite painful. So scapula is your shoulder blade. Humerus is the upper arm bone, okay, humerus. And then the next thing it's showing is your vertebral column. Then it has the coccyx at the bottom, the frontal bone of the skull, maxilla, mandible, sternum, rib cage, radius, sacrum. So that's kind of going out of order here. So as they pop up, you can see that the sacrum is pointing to the upper of the tailbone, right above the coccyx, right above the tailbone. The radius, now if you were to sit and stick your arm out and have your thumb in the air, all right, the bone that runs across your forearm, and then if you run your hand across your arm to your thumb, that's going to be your radius. The underside that runs on your pinky side, that's going to be your ulna. Ulna under. That's the way that I always think about it. Ulna under. And that should pop up next. Carpals are going to be the wrist bones. Metacarpals, hand bones. And then phalanges are the fingers. We see the pelvis right there, the pelvic girdle or hip bones. We see the femur is the upper leg bone. Patella is the kneecap. Talus, metatarsal, so talus are going to be ankle bones. Tibia is the main weight-bearing bone of your lower leg. Fibula is the secondary smaller bone of the lower leg. It doesn't really bear weight, but it has a lot of muscle attachment. So if you've ever broken your fibula, you still can't really walk. And then we have the tarsals and phalanges are the toes. So here's the scapula. Here's a view of your shoulder blade and the back. You can feel it. If you touch it, you can feel it moving. Reach around and touch your back, your upper, or, right below your shoulder, and you can feel it articulate as you move your arm around. Same with the clavicle. We already had you do that, touching your collarbone, feeling that move. Humerus, the upper arm bone. Okay. Then we have the radius and the ulna, the UCL or ulnar collateral ligament, the bane of pretty much the entire Mets pitching staff for the last 10 years. That's Tommy John surgery, your UCL. So attaching the ulna, and then it's a ligament. Okay, so you have what? We'll get into that a little bit more, but a ligament is going to be bone to bone. Okay, so ligaments are going to attach bone to bone. Tendons, like your Achilles tendon, is going to be bone to muscle. All right, so there's your wrist and hand bones right there. Here's your hip bones. Now, really, you don't need to know much more than obviously the sacrum and the coccyx, but just understanding the pelvis. You don't need to know the ilium, the ischium, the pubis, all that. That's a little beyond. You see right here, here's the femur. We already saw a pretty in-depth look at the femur earlier on, but here it is again with the neck and the head, where the head is going to attach into the hip socket, and when you have a replaced hip, they replace that head of the bone right there. And then here's the tibia and fibula. A tib-fib fracture, if you've heard that, is where it breaks both bones. This is a lot rarer, obviously breaking both, but if you do, it's a much more intensive fix, because now you have to make sure both bones are set properly. Then you have your foot, and you see the tarsals are the foot bones, the ankles and foot bones, metatarsals, and then your phalanges are going to be your toes. All right, and so that ends up the skeleton.